Tay-Sachs disease is a fatal disease most common in children that results from an error in DNA replication. The error causes defects on a gene in chromosome 15 that codes for the production of the enzyme hexosaminidase A. This enzyme, also known as hex-A, helps to break down the fatty acids in the body. Without hex-A, there is a buildup of the fatty acids in the brain that can reach toxic levels and start affecting and damaging the nerve cells, causing a variety of symptoms. Those symptoms include difficulty swallowing, trouble breathing, hearing loss, blindness, vocal impairment, seizures, fatigue, muscle weakness, stiffness and contractions, poor coordination, paralysis, and even death. Tay-Sachs starts while the baby is still a fetus. Once the baby is born, it will develop normally for around 6 months. Then the development starts to slow. The child may lose the ability to sit, roll over, hold things, or crawl. Around 2 years of age, seizures as well as diminishing mental function occurs. The child eventually becomes blind, vocally and mentally impaired, possibly paralyzed and unresponsive. Around 3 or 4 years of age, the nervous system is so damaged that death usually occurs by age 5. The disease is highly progressive and happens fast. There is a very small chance of survival and no treatment for Tay-Sachs disease currently is available. However, some scientists are exploring enzyme replacement therapy in babies. Surgeons are also exploring with gene therapy. This new technique, used in conjunction with in vitro fertilization, enables parents who are TSD carriers to give birth to healthy babies. Embryos created in vitro are tested for TSD genetic mutations before being implanted into the mother. Infantile Tay-Sachs is the most common form of the disease. Symptoms usually start appearing around 6 months after birth, and are usually losses of certain abilities the child could do before, loss of vision, trouble swallowing, and can escalate to seizures and paralysis as the disease progresses. Usually death occurs by age 5. Another form of Tay-Sachs disease is juvenile TSD. Symptoms usually occur during early childhood and may include slurred speech, muscle weakness, speech impairment, and loss in their ability to walk, talk, and eat. The final and least common form of Tay-Sachs disease is late-onset TSD. At first, slight signs will appear in childhood, such as speech impediments, not being very athletic or strong. Symptoms that develop in adulthood may include muscle weakness, mental health issues, decline in mobility, as well as breathing and swallowing difficulties. One symptom of Tay-Sachs disease is cherry eyes. The small spot shown in this picture is able to be seen by doctors in the backs of children's eyes who have TSD. The spot itself is normal, however, the white area around it is what makes it more noticeable. Another way doctors can diagnose TSD is by doing an MRI scan. This is a scan of a 1-year-old girl's brain. At first, she was developing normally, able to hold her head up and sit on her own. At around 9 months, she lost those abilities. In the left picture, everything seems normal. However, the right image was scanned at a higher intensity, which then revealed swelling in parts of the brain. This, along with cherry red spots behind the eyes, startling easily to noises, and losing physical abilities are all signs of Tay-Sachs. This is the story of a girl named Christy Anna Carl Steiger. She was born on January 26, 2006, to the parents Bruce Steiger and Rick Carl. Bruce and Rick had been trying to have a baby for 3 years straight. However, this was the first success. This consisted of 8 surrogacy attempts, 3 miscarriages, and 5 other failures. Christy developed normally for the first 6 months. However, around 8 months, she wasn't able to keep up with the developmental milestones which her parents realized after their trip to Cape Cod. Some of these milestones were to be able to sit up and hold her own bottle. Later on, they signed her up for gym classes for 3 to 11-month-olds. However, they noticed that the 6-month-olds seemed to be much more alert than Christy at 9 months. Christy also couldn't sit up, clap, and made almost no attempt at crawling. After this, they went to the doctor, and a pediatrician ordered tests. However, none produced a diagnosis. At 10 months, Christy began physical and occupational therapy. Then, Bruce and Rick noticed that she became really easily startled to noises, which is a characteristic of TSD. Right before her first birthday, they ordered an MRI. This revealed abnormalities in the brain indicating possibility of a metabolic disorder. She then got her eyes checked, which then revealed cherry red spots behind her eyes, yet another characteristic of Tay-Sachs. From there, they ordered a blood test to confirm the diagnosis. Rick and Bruce were then told to just take her home and wait it out to make her comfortable since it wasn't likely she would live long. While there is no real treatment for TSD, the doctors mentioned something about a potential treatment involving stem cell transplant. Bruce and Rick were eager to try this. Christy was admitted to the University of Minnesota Medical Center on May 10th of 2007. She went through 10 days of chemotherapy and 1 day of total body radiation to completely wipe out her immune system. Christy then received donated stem cells from an umbilical cord blood in hopes that her body would reset and start producing the missing enzyme. The transplant was simple and took about 1 hour. However, the recovery time took 89 days from intense chemo and radiation. After her recovery time, she was out of the hospital for a while, but still had regular checkups once a week. Her body was producing the enzyme, but no one knew if the enzyme would reach her brain in time to slow down or stop the progression of the disease. Sadly, Christy died at age 9. However, Bruce and Rick